Welcome to another episode of Fight the Burnout. Today we have a very special guest through another friend of mine who's actually been on here. Fabrizio recommended it's Kinga Porter. She lives in Florida, and she is a medical doctor over there. She does internal and external medicine. We'll let her describe it a little bit, but in turn, from what she was just telling me before, is it's all about preventative. As she was saying, she wants everybody to live to 100 with no medical stuff at all. Hit 100, sweet, life's cool, sweet, I've done it, and drop dead without any long-term things. So, Kang, why don't you tell us a little bit about yourself? We like to let you describe yourself because you can do it. You know yourself better than anybody else, so you can do it the best.
Yeah, hi guys. So I am double boarded in internal and integrative medicine. I take the best of both Eastern and Western medicine and see every problem as a spectrum. I mean, nobody develops diabetes overnight, and nobody develops heart disease overnight. And my goal is really to prevent all kinds of chronic disease from happening and to make sure people have amazing quality of life. So I see all kinds of patients. We tend to focus on diet, exercise, mental health, meditation, you name it, we do it. Obviously, if medications are needed, I use them, but I try to avoid that.
Yeah, no, I love that. That's pretty much what we're all about as well. We were talking about this just before, it's all about preventing it. So I think of the analogy, falling off the edge of the cliff is the getting all the health stuff. So why wait till you're at the bottom of the cliff and see the ambulance? Why not stop before you even walk up? So that's awesome. So I know you obviously, I know that how it works in the States to go through school and all of that. It's a long process. How many years is it taking you to get to where you are now?
So 4 years of undergrad, 4 years of medical school, 3 years of internal medicine residency, and then integrative medicine on top of that.
Whew, that sounds like a lot of study. A lot of you must be definitely passionate about what you do. So can you tell us, because I like to get everybody to describe what their description of burnout is, because everybody has a different level, different description, different analogy on it. So what would you define burnout as for yourself?
I really think that the definition of burnout is being unhappy with what you're doing in your current situation. Whether that means that you no longer enjoy your job, you no longer feel passionate, you wake up in the morning dreading getting out of bed. To me, all of that is burnout. And in the long run, all that has both mental and physical health consequences.
Mm. So can you tell us a little bit about an experience that you've had with burnout? I know we all have it literally, like it constantly, they have a tendency to come back, but what are some of those big ones that you've had? Because I know everybody has them, whether they want to admit it or not.
You're so right. My big one is probably spending all those years of school and learning, and then residency training. You're working 120 hours a week, and then you get your first job and you're like, oh yes, this is sweet, my first job. And then you're like, oh shit, I have student loans to pay off. So you finish residency, have a baby in between there, and you're still working 120 hours a week. I mean, I remember I would be in the office from 8 a.m. to 5 p.m. Before the office, I would go around at one hospital. After the office, I would go around another hospital, and then I would still take call all night. I mean, it was like 24/7 nonstop. So yeah, that was fun.
Yeah. Wow. Yeah. No, I not quite that far, but I know like doing like protection stuff. We used to do like 19-hour days for like 7 days straight, sometimes, 2 weeks, but for that long, yeah, no, no thanks. Um, so how did you, obviously, what was it that what ended up happening that got you to shift, got you to change? What was the catalyst, the last straw on the camel's back as such?
Well, I think for starters, I think one of the problems that happens is when you start doing the same thing every single day, you kind of forget that it's not normal.
Hmm.
So one of my biggest problems is I've never really required a lot of sleep throughout my life. So I got into this routine of work, 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 work.
Hmm.
And at one point I felt that it was normal, and I felt like the rest of the world was crazy and lazy because they weren't doing enough, right? It's completely asinine. And eventually, so through all that, I ended up having 2 kids, and it wasn't until my older one started going to school and started saying, "Hey, mommy, can I have a play date? Hey, so and so's mommy wants to meet you." And I started realizing that I was missing out on my kid's
Mm,
life. And then
yeah.
I was like, wait, all those other parents are doing stuff and getting together and having play dates and having, Girl Scouts and Girl Scout leaders. And I don't have any time for any of that. And it wasn't until the kids kind of made me rethink my life that it really sunk in.
Yeah. Yeah. And then what'd you do?
Well, then I eventually opened up my own practice.
Yeah.
So that was helpful because I had more control over my schedule. So, I got to say what was happening when. So
Hmm.
that was a huge step. So I started pulling away from as many hospital hours at that point, more flexible schedule. And then once COVID hit,
The
that
lovely
was
COVID.
actually, I gotta say 2020 was phenomenal, very eye-opening for me. COVID sucks,
Mm.
but so many good changes took place in my life because of COVID.
It's interesting you say that because so many people that I know, like, and you either had a great year last year in 2020, or you absolutely hated it. And
Yeah.
I feel like it's all a matter of what you actually, the perspective that you look at on whether you hated it or not, because so many good things, like you just said. So what are some of the good things that came out for you?
Definitely more time at home, more time with the kids. I started woodworking. I've flipped like half my house, like all the stuff you see in here. I did that myself.
That's
Uh,
awesome.
I have an awesome miter saw now, and I drive my husband crazy with like my nail gun and my compressor all day long. So I found a really cool hobby.
Yeah.
Love it. It's been great spending so much time with family, and I don't really want to go back. I mean,
Awesome.
financially, I took a major hit
Yeah.
last year. I mean, don't get me wrong, financially, it sucked, but really, money isn't everything.
Yeah. No, I love that. So that's awesome. So obviously COVID has really shifted you from that burnout to a massive just look after yourself, money's not everything kind of thing. What are some of the other things, like obviously parts of the world, you're in Florida, so I'm not too sure what it is. I know Florida, everybody that I know that's in Florida is like, it's the more kind of openish state, I guess you could call it. So I take it, practice is probably opening back up. You probably are seeing, correct me if I'm wrong, a lot more stuff around the COVID kind of situation, and a lot more
Actually,
restrictions and stress. And
yeah, I'm doing mostly telemedicine still.
yeah.
Uh, so I'm still pretty limited in the office.
Yeah.
Um,
So with the stresses that come with obviously that side of stuff, what is it that you're doing to help prevent yourself from getting, going, oh, I'm not, the income's not as much there, the stress of I'm not having that human interaction, I know as a doctor, the few times that I have gone to see one, is, there's a lot of, physical things that are actually done through it. So how do you shift that?
yeah, I mean, I think you just have to figure out what your priorities are.
Mm,
I had a lot more personal human interaction in my social life, which has
mm,
been awesome. And then in the office, I've just gotten more creative. It's fascinating how quickly you realize that the majority of people that you see in the practice, you don't have to physically see.
mm.
So many people are in for blood review or medication refill or talk about depression. I mean, yes, some people still need a physical exam, but I kind of feel like we were doing it wrong the whole way.
Putting too much work into it all, eh?
Yeah.
I love it. I love it. All right. So obviously, what are some of the things that you do specific to prevent yourself from getting into that burnout stage?
I have realized that sleep is more important than I initially thought. Despite the fact that I am totally capable of functioning on 3 hours of sleep a day, I am a much better human and a much happier human when I get like 6 to 8.
Yeah.
Definitely much more snappy with less kids. My husband totally agree with that. Uh, Sleep's important. Diet's so important. I've always, known that. It's always been very difficult for me to obtain that because of my schedule. So we've been doing a lot more meal planning, cooking in the house. I've definitely been drinking a little bit more wine, but
Hey, priorities, hey.
I joined the wine club. It's been awesome. Uh, but I've just been focusing a lot more on myself, my mental health, my family, my friends, and
Mm,
really it comes down to the things that are really important in life. And I think we all have to decide if, do we work to live or do we live to work? And I
yeah.
think there's a huge difference between those, pathways.
Yeah, no, I like that. Yeah, it's definitely one of those things that I think, I mean, originally being from the States, but I left when I was a teenager. But seeing my mom did pretty much the same thing. She was working and working, absolutely loved what she did until the day she didn't. And she had her own, she had a very successful chiropractic business and, was crazy busy. But then she realized I'm not seeing my kids
Hmm.
and I'm not enjoying this as much. And there's all these different regulations. And so they were going to go off and go sailing around the world once my brother and I went to college. And she went, screw it, let's take them. And, she was also doing overseas, like she'd do dive trips, like month-long dive trips and stuff like that for herself. But she was seeing the world change and she's like, let's take them. And so that's what we did. But I know that there's still that mentality of that work, 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 and there is no rest side of stuff. So how do you feel that can shift? I know COVID has caused a lot of shift if you let it, but how do you see that for us moving forward in this COVID world, but also just in general, so that shifting to actually taking care of ourselves and living, not just work, work, work.
I really think it's going to have to happen on an individual level,
Mm,
especially in America. I mean,
yeah,
other countries like New Zealand, where you have subsidies for having a baby,
mm,
right?
yeah.
You get 1 year of maternity and some paternity leave or something
Yep,
crazy.
yep. You get all the good benefits of the
Yeah,
socialized medicine, and yeah, I
yeah.
mean it's
I had three and a
basic,
half.
but
Yeah, I had 3.5 weeks of unpaid leave for both kids. I mean, that's
mm,
crazy to go back after 3.5 weeks, right? So until society, at least in America, changes, I think that mentality of you have to work, 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 work is going to be really hard to transition on
mm.
a greater level. So it's going to have to be done on an individual level, unless something crazy happens in America and we become more socialistic. But who knows? I don't even know
Yeah.
what's going on.
Okay.
So
Awesome. Awesome. So what is it that you do? Like obviously you've got a team that works with you, like you'll have administrators and things like that. So what do you do for them to help them prevent burnout?
yeah, so we're actually a very laid back office. We're more of a family. We check in all the time, make sure everybody's doing well. I make sure everybody gets breaks,
Yeah.
everybody gets vacation time. We all of us actually hang out together. So I am very cognizant of that because I know that if your employee is burnt out, they're going to get resentful. They're not going to be as good at their job, and that's going to show for something like a medical practice.
Yeah. Especially
So
that interaction with like clients,
yeah,
the first interaction is receptionist normally. If the
yeah,
receptionist is grouchy and is having
yeah.
a bad day, the client's gonna be like, "What the hell? I don't want to come back to this place."
No bad days allowed.
Yeah, yeah, no, yeah, yeah, no, that's cool. So, I'm a huge why guy, and I read your bio on your website, which was pretty cool, and it pretty much states it out there. But I want to hear it from you. What is it that you feel is why you do everything that you do? Like what I've recognized from doing lots of coaching with people is everybody has something that stems back to their childhood. There'll be some sort of incident that happened when they were pre 7, 8 that kind of concreted in a habit or a focus of why they do what they do through everything that they do. So what would you say? What do you reckon or feel yours is on why you do what you do that keeps you through the easy, makes the easy times even easier and the hard times not so hard?
Yeah, I've always really had a passion for helping people.
Mm,
And part of that was probably imparted in me due to the fact that my dad went into kidney failure when he was really young.
yeah.
So my dad's actually had 3 kidney transplants.
Oh, wow.
We're waiting for that stem cell kidney for the next one. And so when I was little, I saw him suffering, saw him going to doctor's offices. And even when so I was actually born and raised in Poland.
Yeah.
So even when we were in Poland, people would always say, this is what your dad has to do to be healthy. This is what he has to eat. He can't be stressed. He has to be as good to himself as he can be. So from a young age, that kind of sunk in.
Yeah, gotcha. Yeah, that kind of that. So that I can see now why you went down the medical side. Do you feel like those things that you learned as a kid from going through the hospital and stuff with your dad, that you use those habits, or did you kind of lose some of them, or?
I feel like I do. I mean, I'm also very intuitive, so I feel like I read people really easily.
Yeah.
So I've always been really understanding of the fact of how much, your health, mental and emotional is important, how much stress plays into all of that, and how really taking care of yourself is going to help you live a productive, long life.
And you do, obviously you do a lot of that with your clients or patients. What are what are the top things that you find you're constantly saying to people that they need to do that they struggle sometimes to do?
Oh my gosh, especially in postmenopausal women, I will tell you, it's like every other patient, I have to tell them, you do know that you can't take care of your family, you can't take care of your kids, you can't take care of your elderly parents if you're dead, right? Because people tend to put others first, especially their family members, and then they completely forget about themselves.
Yep.
And I'm like, but if you die, they all die.
Yep. Yep. That's it's quite a drastic way of saying it, but sometimes, people need it. I preach this all the time, like, with clients I coach or people that I know, or especially like I train a lot of people to get into the police force. So setting them up with the foundations to deal with all the traumatic and stuff that you deal with as a frontline officer. And my biggest thing is I create a pyramid, and it's like the base layer is yourself. The biggest section should be all about you. Be selfish. Don't worry about what others think. Just take care of you, and then take care of your family, and then work at the very top. And everybody flips it upside down. Like,
you can't go save the person that's in a car accident if you don't look both ways and make sure you don't get hit by a car yourself, right?
Exactly. It's like the airplane analogy for those things that we used to fly around in. But it's, put the oxygen mask on yourself before you put it on somebody else. Otherwise, you're gonna die and you're never gonna get it on. So no, I love that. So like, hang on. So if someone's unsure of their why, I know there's a lot of people that are unsure, that haven't had like something where it's like, oh, thrown right in their face. What advice would you give them to try and figure it out?
I think the most important thing is figuring out who you are. I feel like so many people are so kind of caught up in the daily life that they don't even know who they are. They don't even really know what they like. They don't know what their hobbies are. And part of it is discovering yourself, which means you actually have to spend time with yourself, right? And that takes time and effort. And it's something not a lot of people are willing to do in their day-to-day lives. So whether it's meditation or a trip like you took, you've got to discover yourself.
And I love that. Yeah. So many people are afraid of it.
Oh yeah, so many people are afraid of it. Yep.
Yeah. So what would you say to the people that are afraid of it? I know this year has forced a lot of people to sit in themselves because of the lockdown. You ain't going anywhere.
Yeah, so to the ones that are afraid, sometimes you have to be willing to not be afraid and to step up and make those tough choices to have your best life. So many people are afraid because they're not sure that either they're going to like themselves or that their close ones are going to really like their true selves. But you got to live honestly with yourself. You can't just be a lie all your life.
Yeah, no, yeah, definitely. So obviously, being a physician, a doctor over in the States, or anywhere really in the world, it's a very, as we've already talked about, it's a very high stress, high hours, lack of sleep, and it's just become the norm. So if you were to be able to talk to either, somebody who's just starting out in that, or to even talk to your own self, when you first started, what advice would you give to that person?
Oh my gosh, that's a super hard question. So that's actually like a double-edged sword in my mind in medicine.
Yeah.
Because if you don't put in the hours and don't put yourself in those crazy stressful situations in medicine, then you're never forced to learn and never forced to make those tough decisions, right?
Mm,
But at the same time, you do burn out. I mean, like
yeah.
you do. So I don't know. That's super rough. I know that, for example, for residency fellowship training in the last couple of years, they've changed the hour requirements, so they have a cap. So like after like 26 hours, you have to go home no matter what,
Yeah.
which is like asinine to me. Because
26 hours. That's like what they put Navy SEALs through that as like punishment, as like, let's see what you're capable of. Let's keep you awake for a week and only give you 2 hours of sleep a night.
yeah,
And then we're gonna go put you out in operation and see what the hell you're capable of. That's just and you're trying to save human lives while you're at
part of it is, it's good that they're making those restrictions, but part of me is like, man, they're baiting those people. They're never gonna know what to do in the real world once they come out, because the real world hasn't changed.
Yeah.
You
Yeah.
know, so how do you change that kind of workload of a physician once they're out of training? Part of the issue is we don't have enough physicians to go around.
Yeah. More and more people are getting sick.
Such a complicated
Yeah.
topic. That one I don't have a good answer for. Sorry.
That's all good. That's I can see like I thought being law enforcement, but yeah, I mean, yeah. How do you tackle such a big? I mean, I guess you just take one bite at a time. You just tackle the elephant one bite at a time. But I mean, I guess it's the same thing with changing the culture of policing. Like I'm trying to do, and a few other people that I know, it's, I guess for me, I'm trying to change it from the outside in. So before you even get in, so I guess in a way restricting, and I'd love to have your thoughts on it. Restricting when you're going through residency will then end up taking those guys, and then they'll start going, okay, cool, we need to restrict afterwards. But like you said, we don't have enough physicians. So I guess it's doing what you're doing and helping prevent it so that they don't have to see the physician.
Really, yeah.
Okay. I love it. So if somebody wants to get in touch with you, Kinga, and they want to, talk about, whatever is going on, or say they want to, obviously you're doing a lot of prevention work. They want to actually go, sweet, I want to do prevention work. Are you doing anything with people outside of your area, or are you just doing stuff with people that are kind of in your area? So if you need to see them, you can.
I do both via in person and telemedicine. I actually have a couple, an older couple that sails around the world, and yeah, I actually see them in person like once every 18 months or so.
Yeah.
And other than that, they'll shoot me a message and they'll be like, I'm in this country during these days, and I'd love to do a video with you, but your 5 p.m. is my 4 a.m. How do we coordinate?
Yep.
So much fun. And then trying to get them prescription medications. Oh my gosh, it's been a hoot. But yeah, people from all over, whether it's video or I have a bunch of patients that fly in to see me and then they vacation in Florida a fair bit. So I do a little bit of everything.
Cool. So if someone wants to get in touch with you and have a chat with you, or that, I know we'll have your website in the description of the podcast and that. But how is there any other way that they can get in touch with you, or just through the website?
The website's probably the best. It's got a portal on there where people can register and actually make their own appointments.
Cool.
They can call, they can email, almost any way works.
All right, perfect. Awesome. Yeah, no, I love that you're doing a lot of prevention stuff. Before we go any further even, can you go into detail about kind of what it is, like what it would be like step by step? Say you don't know me, besides today. If I went, hey Kinga, I want an appointment.
So I think my biggest job is figuring out what are you at most risk of dying from, right? So part of that is knowing what your blood work looks like, knowing your past medical history and knowing what your family history is like. So if everybody in your family dropped dead of a heart attack by the time they were 45, well, we need to prevent your heart attack, right? Because it's common.
Yeah.
Everybody in your family has autoimmune disease and you just got diagnosed with lupus, well, we're going to focus on that because that's probably your base risk factor. So part of it is figuring out the risk factors, looking at what the blood work looks like, and then kind of going from there.
Oh yeah, cool, awesome. So this is my favorite question. It's the last one. What is the thing you would tell viewers, the number one thing you would tell viewers to help them prevent or counter burnout?
Figure out how you're going to make time for yourself. I tell everybody that you need to make a plan ahead of time. What is your 1 minute break? What are you doing? You're doing your 5 minute break, your 30-minute break, your 1 day break, and your weekend break, right? Because sometimes you don't have the whole weekend, but sometimes you need to take a minute or 5 as a breather.
Yeah.
And whether that's meditating, painting your nails, sitting in the bubble bath, I don't care, but whatever does it for you, you need to figure that out and think long and hard and make a commitment to yourself to do that.
Yeah, no, I love that. I talked to a nurse actually that I met at the hospital when I did some work there during our first lockdown when COVID first hit. And hers was the same thing. She was like, take your breaks.
Yeah.
Take your break. She's like, the people that are all there, they're still going to be there when you get back. And if they aren't, it's not your fault if you're on your break. But also, if you don't take your break, you're not going to turn up to them at the best that you possibly can. So yeah, taking those 1 minute, 5 minute, 30-minute, hour, daily, weekend, monthly, yearly breaks is, yeah, I love that. Cool. Awesome. Kinga, anything you'd like to add before we finish up?
No, I just want to encourage people to, especially since we have more time now, I encourage people to really take themselves and make themselves a priority. Get healthy, figure out what you need to do in order to make yourself number one.
Awesome. I love it. Well, thanks guys for listening. If you enjoyed this, give us a thumbs up. Make sure you like and subscribe, and also make sure that you hit that alert bell so that you get a notification every time this episode goes live. We'll put Kinga's details down below in the description. And also, if you feel like you're burning out at any stage, or you feel like you want more tools and more strategies, send us an email at info@knockingdemonfitness.co.nz because we want to change the world. Till next time, remember our motto is train hard, test easy. That is both physically and mentally, so that you are ready for those tests, because we're all going to get them no matter what, whenever they're going to come up. Until next time, we love you all, and we'll talk soon.